How is the medical profession similar to independent filmmaking, and how is it different?
That's an interesting question, because rarely do I get that question. Usually the question would be, you're in the medical field, why do you want to be a filmmaker? Instead of a field in general, what's the differences and similarities? Well, aside from the obvious differences in terms of training, I mean, in the medical field, obviously you have to go through X number of years depending on what kind of practice you want. And the more sub-specialized or specialized it is, the more years of training you have to put into it. As opposed to filmmaking, you could get a week-long seminar or a workshop, and now you're a filmmaker. Sometimes you just stay at home and watch videos, and now you're a filmmaker, right? So that's an obvious difference. But then it's funny and interesting because there are similarities to it. Because the training may be different and the profession in itself may be different, but I think what is similar is the concept of entrepreneurship. Because as a doctor, unless you're tied in inside with a big, you're with a big hospital and you're one of their specialists, it's like being a filmmaker, but you're tied with a big studio, right? But if you're an independent filmmaker or a doctor with your own clinic, you have to be entrepreneur. You have to be an entrepreneur, because when you're a doctor and you have your own clinic and you're not tied to a big medical institution, you have to set up shop. How do you get your patients? How do you get your clientele? How do you do marketing? How do you reach out to your audience? In this concept, your patients. How do you do that? You're a dentist. Rarely would dentists be in a big hospital, right? Usually they are having their own clinics. Chiropractors, massage therapists or any other therapists, not to mention just the doctors themselves, but anybody in the healthcare business. They have to be having this level of entrepreneurship, and as opposed to also the independent filmmaker. So I think the glaring difference is really training. But once you're out there in the world, it's the same ball game, right? How do you get your patients? How do you get your audience? How do you get them to keep on coming to you? As an independent filmmaker, what types of projects do you have that would sustain your audience to you? A great example, like Kevin Smith, you have Ed Burns, people like them, independent filmmakers, so to speak, you may agree or not, but then they have the ability to sustain that per project. They have fans who would support them. As a doctor, as a dentist, as any healthcare provider, you have a level of service that you have a constant clientele coming back for that service. So I think that's a big similarity, and how you provide that service, or how you introduce that project, and what you do in that service or project to sustain and maintain that relationship with your audience or your patient. I think that's actually the same. The level of thinking, the level of how you attack that concept. The product may be different, but that kind of relationship, that engagement with your one-on-one with your audience or patient is actually the same. So